Hi, I'm Jen, and I'm going to do hopefully a shorter video about long-term care and about safe consumption sites. These are two other facets of healthcare in Ontario, and I'm trying to cover most of the issues, right? The big issues. So long-term care. Long-term care is not as regulated as it should be. Right now, there are for-profit long-term care homes in Ontario, and it's important to note that during when COVID was at its worst and because vaccines were not yet available, there was huge death rates in Ontario and across the country, but particularly in Ontario and in the long-term care homes. It even killed at least one PSW that I know of. But the problem is that for-profit long-term care homes had the highest death rates, followed by nonprofit and publicly owned long-term care homes had the lowest mortality rates when at its worst. The for-profit homes, if you recall, they actually called the military in because they were unable to keep up. They were having huge staffing issues because of COVID, and because, of course, many PSWs were getting sick. People were more at risk to die in these for-profit homes because, of course, for-profit means sometimes the protective equipment was being reused inappropriately. There wasn't enough protective equipment, so it was used for longer periods of time than appropriate, and therefore that eased the transmission of the COVID virus, deadly COVID virus. So, yeah, there needs to be more regulation for long-term care homes. And the military report, it's available online. People who were living at the long-term care homes, they were dying of dehydration. They were dying of severe bed sores that went septic. It was reading the report. I remember I teared up. It was awful. But anyways, what did Ford do with this information? Nothing. The long-term care homes were not held accountable for the significantly higher death rates of their clients, the people who live there, and the people who work there, PSWs and nurses getting ill and or being killed. Nothing. There was no accountability. Number one, and number two, Ford actually agreed to fund some of these long-term care homes to expand and to increase the number of beds. So long-term care, there has to be more accountability, and it must be regulation as well, just to keep people who live there and people who work there safe. Safe consumption sites. So safe consumption sites, that's for anybody who doesn't know, that's for people who have addiction. Safe consumption sites are like a wraparound kind of maybe not a clinic, but a place where people can go to safely use drugs if they have an addiction. There's staff there who can supervise them to make sure the person doesn't overdose or die while they're using the drugs. They have a needle exchange, which drops the rates, of course, of contagious hepatitis or HIV. And there's also that social interaction that we all, on some level, even us introverts, crave, right? So safe consumption sites are evidence-based, and they reduce the risk of death. They reduce the risk of harm, right? Because sometimes people who have an overdose, and if they survive, they can have significant physical health issues that result from the overdoses. So safe consumption sites can prevent that, right? They prevent repeat ambulance calls for overdoses, right? Because it's a controlled environment, they're able to decrease the risk of overdoses and therefore reduce the risk of paramedics, fire, police being called for an overdose, right? So it saves municipal budgets, which is a big advantage right now as well. The other thing too about safe consumption sites is in addiction medicine, and I'm saying this because the PCs, the conservatives, and some other organizations and individuals want you to think that addiction you either treat or it's a free, they'll make it want to seem like it's a free for all and people are getting drugs and encouraged to use drugs, and nothing could be further from the truth. But the fact of the matter is, evidence-based addiction medicine is a spectrum. It should be patient-centered, meaning what the patient wants. The evidence is that if a person is forced to start treatment and they don't want it, it's not going to work. So all this, we got to be harder on people with addiction. It's not evidence-based and it's designed for failure, right? Um, it's a spectrum. So there will be people who want treatment, and that's where other policies come into play, because if somebody wants treatment, we should have free treatment beds ready for them, not in 6 months or 3 months, but tomorrow or the next day. Basically, once they get their affairs in order and want to go to treatment, they should be able to get a bed. So there's that, number one. And number two, for the person who's not ready for treatment right now, that's where the safe consumption sites come into play, because they keep that person alive until that person's ready. And, if that day comes, it may not come, but if the person, decides that they're ready for treatment in 3 months or 6 months or 3 weeks, then they're alive to make that decision, right? Because the addiction or the opioid poisoning epidemic here in Canada has cost so many lives. There are human faces to this issue, and it's so important to remember that. So the safe consumption sites, this is a big issue for many people, especially people who have had loved ones or themselves who have faced addiction, sometimes with the worst outcomes, in terms of just dying from an overdose, right? So the bill was passed last fall in December, I think, in the Ontario legislature to ban safe consumption sites. The Conservatives voted for it, and so did the Ontario Liberals. Karen McCrimmon, the MPP and a candidate now in this election, voted to ban the safe consumption site, and that's important to know. So if this is an issue that's dear to you, you may want to ask Karen and other candidates what their position is on safe consumption sites, because again, this is evidence-based, and it does not make any sense that we should be willing to let somebody die from their addiction as opposed to keeping them alive so that they might want treatment sometime in the future. It was a cruel bill. It never should have passed. Anyways, with issues like these, please get involved. Read the platforms with regards to issues that you care about. And if you're watching this, you probably care about healthcare. And then ask the candidates, ask your local candidates, ask me, ask other candidates. If you're not from Canada Carleton, ask the candidates in your riding about the issues that matter the most to you, whether it's long-term care, primary care, hospitals, how they're funded, and that sort of thing. Nurses, healthcare workers, doctors, what's going to happen so that we can get more of these. And of course, supervised consumption sites. These issues and more, if they matter to you, then just make sure that you're voting for a party or a platform or the candidate that you feel will take these matters to heart and do what they can to right things and to make things right and to preserve our publicly funded healthcare system and improve it, of course. Thank you for listening.